Alright, you're live.
Alright, you guys, the final female sculpting of the day, and that's why I'm like this right now. I'm ready for my last injection. We're going to do Danielle, our PA, because she needs to experience the face by Emer. No, the facial sculpting technique that we're going to do, because she already looks really good, but we're going to enhance her features. Lateral cheek, chin, softening the folds, and improving her eye. She's really a candidate actually to have under eye surgery, similar to what I was talking about before. She's very bone structure is very high here, but very flat here. So she sees her under eyes more than most people would at her age. So you can use fillers to camouflage them, but they're always going to look a little puffy regardless. So you could do surgery or we could do non-surgery. So we're going to enhance the lateral cheek first. Very defined jawline. We might put one little dab right in there too, because we want to balance all of that. So we just do little aliquots. Now she loves this elevation. So let's do a little estimate here. What would a 0.2 do? That's how much elevation it would do. So let's blend that and give her a nice lateral elevation right on the bone. And you see as we go down, it's really giving a nice definition. And then the submalar area to give a little support. Okay, hold here for a sec. Soft, flat.
How does it feel?
And
feels okay.
What's nice about Voluma is she's going to get a nice elevation, but it's going to be soft. And Voluma is indicated for mid-face. So this is a perfect placement for this Juvederm product. What girls don't like elevated cheekbones? I don't know any. But men do too, just in a different way. So when you're doing a man, we're doing it completely different than this.
And it can be subtle. I always tell patients when I'm injecting them that I just want them to really see where they want to put their blush and their highlight.
That's true. You can ask them. You know, because I have a patient who literally he comes in, I inject his cheekbones, and then he goes puts his makeup on. And then he says if it's perfect or not. Because he knows based on the makeup what look he wants. Right? And so girls do the same thing. So we're going to do just subtle mid-face and submalar area. Just to soften everything. You bleed easily.
Me?
You do cannulas on you.
Oh gosh.
Okay. Hold on. Hold right here. Flat. We'll balance the cheek and the chin together, and then we'll take a look. And we'll go to this side. Perfect. You can see already, look at that nice lift. Okay, look up a little bit. So for her, we're going to go right on the bone. Bring it forward a little bit. And by improving the chin, it improves the neck. So a lot of people...
How come you're not using a cannula for the chin?
You don't really need to. I mean, you can. We've done it numerous times. It's on my Instagram and my... Great. I'm going to throw this out. It's on my Instagram and my YouTube. We're just doing it in a different way today. Forward a little bit, turn towards me.
Making my dimple.
here a little bit. There you go. Go right on the bone. You don't want to do too much for her, but she does have a little marionette.
Mm-hmm.
So just a teeny bit into there wouldn't be a bad idea. Yeah, she breathes easy. So hold right here. Hold that down. Great. Thank you. That's okay. Look up a little bit. And a little bit into that marionette to blend.
What do you think of Radius?
We love Radius. We use it a lot for jawline contouring, cheek area, hand filling. But we're using reversible fillers today because that's what patients really want. Now, we also want to enhance this lift here and improve what's called the OG curve by improving the temple area. So there's a couple ways you can do this. We're going to go into the deeper part of the temple first and get more elevation. Work to get a little bit of elevation here in blending. And then what we're going to do, and I showed you guys this technique before, we're going to go right into one spot on the brow, just do a little bit that we're going to support the lateral brow to get a lift and blend it down. Perfect. And come back. Good. Turn a little bit this way. We're going to go all the way down.
For anyone who's wondering, it just feels like pressure.
Yeah, it shouldn't be bad.
It's
This
really
can
not
give
painful.
a little lift to the brow. And again, that support area on bone, supporting the bone right there. And press that down. Great. So now we did the main architectural areas. What I want to focus now on is what I call the fine tuning. Architectural areas, temple, cheek, chin. Now let's focus on hydration. Let's improve the lips. Very little, no one likes this. But we're going to use Volbella, you guys. This is one of the best products in the lips. It's one of our go-tos because everyone wants a subtle, soft look now. In the past, people wanted more extreme and more robust, but now they're looking for soft and unknown. And that's what we're doing with Velour. You're going to get a year's worth of softness and hydration. Perfect. Which is doing great.
Seema said, "Hi Danielle, so no gym tonight?"
Nope. Nope. She's here doing social media. Okay, we're going to give her, again, the subtle lifting. Everyone tears up when they do lips, no matter who they are, especially around here. I know, it never feels good.
It's really not even the poke that's so bad. It just, you can feel it. You can feel it trigger in your eyes.
Yeah, it just happens.
Someone said, "How many awards are you going to win in Vegas this year?"
Who says that?
Some viewer.
More than last year.
What happened?
In it.
How many awards are we going to get in Vegas?
Oh, I hope we win more.
More than last year.
That's a nice subtle plump. It's a nice, isn't it nice? Mm-hmm. And then we like to soften around the mouth with velour. Up a little bit. Smile as big as you can. Just to soften just a little bit to the nasal labials. Nothing crazy.
Well shaped.
Yeah. Got to follow the normal anatomy. When you start to create a different anatomy, that's when people look abnormal because it doesn't fit their facial shape. Softening all around the mouth.
Okay.
And velour is a hybrid between Voluma and Volbella. And we like it because it can give me a little more substance, and still last that same amount of time. I just want to do a little bit more here. I'm sorry. I know. There we go. Now it's better.
Is there any downtime from this?
No, you can still go to work. You just might be bruised. Why not? I don't see any. Good. So then lastly, just to limit any bruising in the under eye, we're going to do our 1 cc Volbella using a cannula. So look all the way up. We're going to go into the under eye area using a cannula. You can see our 1 cc Volbella, very soft. Go ahead. Look. Of course. The one spot where she bleeds. And we're going to go right up into that trough.
Will she feel sore tomorrow, and can she wear foundation tonight?
Well, it's late night. I don't know why she would wear foundation tonight.
Because I'm going to the gym. I gotta look
Very
good.
clinic tomorrow.
But yeah, she could put on makeup if she wanted immediately. And what was the other question?
Will she feel sore? Will her whole face
She
feel
may
sore
feel
tomorrow?
a little sore, but if it doesn't, it's
I
all
always-
worth it, you guys.
I always find that the areas on bone you tend to feel a little bit more sore. Like if I was to go to yoga in the next couple of days and rest my chin on the mat, I would feel that. I would feel a little bit sore, but nothing that gets in the way of anything.
Oh, sorry, I'm switching sides. So that one side's done. If you take a look at the difference between the two, you can see a drastic difference there. We're now going to go to the other under eye. Everyone always looks like hell right now.
Oh, great.
You know, it's like crazy. We're just doing very small aliquots, you guys. Very little. But I'm going all the way around the eye. Full periocular rejuvenation. So remember I told you don't want to miss out on that lateral eye area. We're using a cannula, which is blunt-ended. So you really shouldn't feel that much. And then my secret technique at the end is to inject into that lateral eye area just a small bit.
What does the cannula do?
Cannula limits bruising and pain.
And you can have cannulas at different lengths so you can reach different areas that you're limited to with just a shorter needle.
Okay, we're all done. At least for a good starting point. So let's clean her off
It's gonna look really good.
and let's show her.
That's great.
Hold on, let's get the blood off. Don't show her yet till the blood is gone.
That's all help.
I know.
I'm very big into alcohol, tons
Me
of
too.
alcohol.
Only looking at
Good. Everything's soft. Okay. All right, now show her the result.
Oh, nice. Yeah, definitely more lifted throughout the cheeks, and the under eyes are so much softer.
great.
My lips are swollen. Chin looks
Projection.
Oh,
good.
the under eyes are
Lips
so
look
much
great.
better.
Under eyes look
So
great.
much better.
Yeah,
It's been
those-
killing me. Yeah.
So,
Awesome.
so again, you know, this area gets a little swollen, so people look a little lumpy bumpy. We have the elevation, we have softening here. Again, candidate for surgery, but this is the improvement we can get without it. And then some softening to lip. She's on Accutane, so that's why her lips are very dry.
Totally dry.
But other than that, that is facial sculpting, guys, and I think that's a great result. So, good night.
Good night. And what did they say?